Good morning, respected judges and team. Thank you for giving me the opportunity to present, and I'm sorry for the delay from my side. So, I'll be presenting a study of two-arm, triple-blinded, randomized, open-label, prospective, parallel design, phase 2 integrated into phase 3 study to evaluate the role of CARICUP. So, you know that a lot of chemotherapy regimens that we give causes thrombocytopenia. Grade 3 and grade 4 thrombocytopenia is 3 to 25% of the patients, which causes some amount of delay in cycles. These delay not only reduces the efficacy of chemotherapy, which may lead to reduced increased chances of relapse or increased response rate, but also causes logistics and economical burden on patients. Patients travel from some of the outskirts and just coming and denying cycle of low platelet count and calling them back for 3 days is some sort of logistical burden. So the current option thrombocytopenia we have is either wait and watch, and once the platelet count improves, give the next. For platelet count or those presenting with bleeding and count, to transfuse platelets. Crelvecin, which is an interleukin 11 analog, and romiplastin and eltrombopag, which are thrombospondin. There is no specific guidelines as to how to increase the platelet counts or what is the safe limit to proceed for the next chemotherapy. Medical oncologists keep 1 lakh as the to give the next cycle. Next, so to Caris papaya, it is traditionally used in dengue fever. Although there are not many studies which have been done in thrombocytopenia of Caris papaya, there is a randomized trial which has been done in Malaysia for dengue fever. That had seen patients with dengue fever who were given papaya extract versus placebo, and they had seen that there was statistical significant rise in the platelet count the Caris papaya extract. So how does it act? It lipo expression as well as increase the platelet activating factor receptors, which are the precursors for platelet production. In that study, they had seen that papaya extract increases the ALOX12 gene expression 15, and there were no major side effects with this extract. Next. Why do we want to give Caris papaya? One, because whatever studies phase 2 or randomized studies done did not show any major side effects. It is very much cost effective, and we have oral tablets which are available for leaf extract. Next. Yeah. So we tried to do a study to evaluate whether the CPLE, that is Caris papaya leaf extract, given for 4 to 10 days, improves decreased platelet counts faster as compared to. And secondary aim of the study was to see the safety and tolerability of Caris papaya. Translational outcomes were ALOX12 levels in the blood, which were checked on the day 4 of giving the drug. Next. So it was there were 2 arms. It's a blinded study, randomized 2:1, placebo-controlled trial. Phase 2 integrated into phase 3. The phase 2 was to check the efficacy, safety of, and phase 3 to check the efficacy. Next. So criteria: patients with metastatic solid malignancy receiving chemotherapy with no active bleeding, no previous cranial bleeding or induced bleeding, ECOG PS 0 to 2, platelet counts in the range of 25,000 to 75,000, hemoglobin more than 8 gram %, and TLC more than, and ANC more than 1,000. Or radiological evidence of any received any growth factors in last 2 to 3 weeks, received 2 cycles of current chemotherapeutic regimen, between 18 to adequate organ function. Next. So we excluded patients with serious comorbidities with history of recreational drugs in last 30 days, patients who are unable to swallow oral medications, platelet count less than 20,000, patients with grade 2, grade 3 thrombocytopenia, but currently diagnosed to have vitamin or folate, patients with thrombocytopenia and with diagnosed iron deficiency anemia, and this is next. Fulfilling the inclusion criteria were selected and following tests: a complete physical examination, complete hemogram, liver function, cell function test is level, serum iron, TIBC, folate, and B12 levels. Next. So we divided patients into two arms. Arm A was CPA 1100 milligrams per a day for 4 to 10 days. Arm B was placebo thrice daily for 4 to 7 days, which is physically in the form as in tablets. We did a safety analysis after 33 patients to see whether it was well tolerated and what are the side effects with that drug. And after the next phase, so we did repeat platelet 3 to 4 days till recovery platelet counts more than 75,000. And interim analysis was done with 22 in the interventional arm and 11 in the placebo arm. If less than 5% of the adverse effects, the study will take further. Will be taken. So we'll include 219 patients. Next. So also the peripheral PVC or the baseline on day 4 will be used for RNA extraction, and ALOX12 gene will be seen in both arms of the study. Statistical test, two-sided Fisher's exact test will be done, and the significance level is 0.05, and it will be performed in compliance with the ICH Declaration of Residency and International Committee of Harmonization for good clinical practice. Next, thank you.